Good afternoon. Since Tuesday, April the 7th, we have seen a 39% increase in confirmed COVID-19 cases here in Baltimore City. As of this morning, the city has 638 reported cases, 243 people hospitalized with COVID-19, and 13 deaths. We remain committed to scaling up our response to this emergency while continuing to leverage the wealth of medical and public health expertise right here in the city of Baltimore. Building from the announcement made last week about the private-public partnership, which is committed to supporting our community, I have a few updates that will offer more information about the program and what it means for our residents. I'm excited to announce that this public-private partnership is ready to launch our dashboard to provide residents with essential information. To help keep residents informed as we progress through this national emergency. Along with the call center we announced on Tuesday, these are resources focused on providing information to our residents. This operation is critical in supporting people from the safety of their homes. We cannot stress this enough. Avoiding hospitals and healthcare facilities when possible can actually save lives. And we're asking your help in minimizing your contact with hospitals and healthcare facilities during this time. Also, as of tomorrow, we will begin testing by appointment at Pimlico, and our health commissioner will talk more about that in a moment. I'm pleased to see that the governor released some racial data today. We are working with his team to get city-specific data on race and make it public. As you can see from our new dashboard, we are seeing concentration in certain zip codes. The largest number of cases in Baltimore are in the 21215 zip code, which is why we decided to stand up our first community testing site at Pimlico in the heart of that neighborhood. Now I'm going to say this again. Everyone needs to stay home. Everyone needs to stay home unless you are going out for essential reasons. Every time you leave your house, you put yourself and everyone in your household at risk. I know Passover began yesterday and Good Friday is tomorrow, followed by Easter on Sunday. Again, I'm asking you to observe these holidays with the people you live with. You can save lives and you can save your life and the lives by staying home for these holidays. I applaud and thank the mosques, synagogues, and churches throughout Baltimore for finding new ways to worship and pray together while social distancing. I know it will be difficult, but staying home this year will literally save lives, yours and your loved ones. Now I would ask Baltimore City Health Commissioner Letitia DeRosa to update you on our COVID response and our work to support the residents of Baltimore.
Good afternoon. Thank you, Mayor Young, for your leadership, and thank you to Care First and all of our hospital partners, specifically LifeBridge. We appreciate everyone's involvement in the public-private partnership and their overall support of a coordinated Baltimore City COVID-19 response. Today, I'm pleased to announce two new initiatives that the public-private partnership has been actively working on. We understand the importance of data sharing in real time with the public as we all work to put measures in place to reduce the spread of COVID-19 in our community. Today, I am proud to announce an online dashboard of COVID-19 case data specific to Baltimore City. This dashboard will allow residents to visualize the information that we have about the number of COVID-19 cases with specifics by zip code, age, gender, and the number of cases over time. This dashboard uses data provided by the Maryland Department of Health and will be updated daily. Just minutes ago, we received race data from the state, and we will be updating the dashboard to provide that data as well as soon as possible. To view the dashboard, please go to coronavirus.baltimorecity.gov. Additionally, tomorrow, as Mayor Young announced, Baltimore will be opening its first city-supported testing site at Pimlico Racetrack. This testing center is made possible through a collaboration between the city, the Maryland Department of Health, the Stronach Group, the Maryland National Guard, and our partners at LifeBridge Health. The Pimlico testing site will require patients to meet certain criteria for testing eligibility and will also require a testing referral form from a doctor. It will not be accepting walk-ins at this time. We are excited to be able to offer this service to city residents as we battle the COVID-19 pandemic together. I will now turn it over to our partners at LifeBridge Health to talk more about the testing capabilities at Pimlico and how residents can be referred for testing. Mr. Dan Blum, President of Sinai Hospital and Grace Medical Center.
Thank you, Mr. President. Thank you. Thank you, Commissioner and Mr. Mayor. It is a privilege for us at LifeBridge to partner with the city to produce this testing site for the residents of the city, our critical assets in public safety, the workers who put themselves on the line, and other members of the community who are really pitching in, most assuredly the healthcare workers. Members of the public can access the site by first calling the city's consolidated number of 211. At that point, members of the public will be screened for symptomology. LifeBridge has nurses and other clinical staff who are providing the resource to screen members of the public over the phone. If callers rule in, meaning it makes sense for them to get tested, there will be oversight of that testing by our medical staff, a medical director. Members will be directed to come to the site at a specified time. The site is highly controlled and contained. We have experience of having done this at 3 of our centers over the past several weeks. And we have been putting people through this process, hundreds of people on any given day. Once the member is screened, the member of the public is screened, they'll remain in their car for the screening. Once they're screened, they will receive instructions as to how to shelter in place and care for themselves, what to do if they see an increase in the difficulty of their symptoms. And then once the test is resulted, that member of the public or public safety workers, whoever receives the test, they will receive a call back from our helpline along with instructions. They'll be informed of the result and then told what to do. We have a lot of technology that we've stood up in order to assure that the process is foolproof. And we've actually put a lot of people through the process already, with some positive results and many negative results, thank goodness. So again, the way to access that screening process is by calling the city's 211 line. Right now, we are planning on closing down one of the sites that we operate to combine our resources with the city, the National Guard, and the state to process greater numbers of people quicker. We will start off tomorrow at 10 a.m. operating that location at Pimlico. And we are looking, we will take Saturday and Sunday to review that process, and then we'll start again on Monday. That site is planned to operate now from Sunday through Friday, taking Saturdays off. And I think those are the main message points that we would like to relate today. LifeBridge, like all of the other health systems here in Maryland and in the greater Baltimore area, stand ready to serve the public. And I would like to echo the mayor's comments. This is a time for people to stay home. It is a time to use masks, sanitary conditions, and to remain calm. Together we will get through this. Thank you, and I'd like to introduce Jonathan Crum from Care First.
Thank you, sir.
Thank you, Mr. Mayor. Great job.
Thank you, sir.
First, thank you, Mayor, the Commissioner, the Department of Health, and especially our clinical partners who have been extraordinary in standing up a complex operation very quickly. So foremost, the call center creates a bridge between the community and healthcare professionals from the safety of their homes. And it's simple to access. Just call 211, and if you have symptoms or think you have been exposed to COVID-19, you'll be transferred to the call center. There, a call center associate will help you walk through an assessment of your symptoms and provide information on self-quarantine or self-isolation if you have mild or no symptoms, help you decide to seek care from a clinician if you have moderate symptoms, or for the severely symptomatic, recommend contacting 911. For those who need clinical support and don't have a primary care physician, the call center will connect you to one of our clinical partners. Currently, that's Johns Hopkins or University of Maryland Medical System, but that list will soon expand to include several other health systems from around the city. Depending on clinical need, these partners are ready to provide a telephone consult or telemedicine visit with a doctor or nurse. If you don't have health insurance, you won't be billed for these services. And if you are insured, you won't be charged a copay or co-insurance. The call center is up and running, and we're available 24/7. Additionally, a symptom checker will soon be available on the city's COVID website that will allow you to check your symptoms on your own online. If you have moderate symptoms and don't have a primary care physician, the symptom checker will refer you to the call center to be connected to telemedicine resources. You can find the symptom checker at coronavirus.baltimorecity.gov. By identifying COVID infections early, delivering isolation and quarantine instruction, and providing access to telemedicine support, the call center can help most individuals stay home. That reduces the spread of infection in the community and among our frontline healthcare workers, and reduces strain on our city's hospitals and emergency rooms. So we can't stress this enough. Calling 211 as your first step in COVID-19 identification, thus avoiding hospitals and healthcare facilities when unnecessary, will help save lives. Thank you.
Thank you to all of our partners. Really appreciate everything that everyone's doing to work together. And I want to thank all of my department heads, again, all of our partners, our city workers, Mr. Gallagher over there, who is heading up some of the things that we're doing with our public-private partnership. I just want to thank everybody. I want to personally thank our city workers, from collecting trash to our health officers, to our code enforcement, to our police, our fire. All of them are going over and beyond to make sure that we're protecting the citizens of Baltimore. So I can't thank them enough for that. And I just want to encourage the citizens of Baltimore to please stay home unless you have to go out for essential services. The quicker you stay home, the quicker we can slow this curve, and the quicker we can get back to some sense of normalcy. So again, if you don't have to be out, stay home. We'll take a few questions.
Based on the new level of data we have now, is the city considering opening additional testing centers? And would those be accessible to people who don't have cars?
Well, I'll let the health commissioner talk about that, but until we get the testing kits, I think it's premature to, open up any other testing sites at this time.
So we were always considering other locations for potential testing sites. I think the Pimlico site is a great place to start because we have a partner like LifeBridge that has already been doing the work. So we will certainly take lessons learned from that site and apply them to other sites as we look across the city of where it makes sense to place sites that will be equitable and accessible by all of our residents. We've always tried to target our messaging at the populations that we know are most vulnerable. So if we're seeing with the data that it is African Americans, certainly we'll look there. I think the health department and the city in general has always taken an approach that we want to be equitable. We recognize that there are inequities and there are significant disparities in residents among our city. So again, we'll look at the data now that we have the race data down to a jurisdictional level, and we'll focus our messaging around that.
Could you just clarify again the capacity of this site, the site? I think the mayor said yesterday it's 50 test kits a day, right?
We received 50 additional test kits from Maryland Department of Health to be available twice a week, but LifeBridge already had existing capacity, so it will be in addition to what their capacity was at baseline.
The state's providing 100 kits per week.
Yes.
Mr. Commissioner?
we actually have a contingency plan that has been prepared in case we start seeing staffing shortages because people either are ill or quarantined. And yeah, we are prepared to reallocate resources, human resources, and move officers around to make sure the entire city is always covered at any point of any level of staffing shortages that we might see.
Elaborate on that contingency plan?
Well, it's in draft format, and we've been working on it for a while now. It's not yet final, and it's evolving every day. But it's a contingency plan that looks at staffing shortages at a percentage. So what does the department do if we should experience 5%, 10%, 15 to 30, beyond 30%? And how we move people around, what assignments become prioritized, and how we move people into the priority assignments and out of the lower priorities.
What is the number where that will be in?
Well, right now it's not a final draft. It will be final very, very soon. Right now, we're not experiencing a significant shortage. All the platoons are covered on every shift, every day. When we start seeing an abundance of people who are not at work and not sick, and we're seeing a low shortage, and it gets us above 15%, then we can start moving people around and pulling people out of specialized units and reallocating resources.
So 15% is just what you're looking at, right?
Yes, ma'am.
And do you have any comment on the ACLU legal challenge about the areas you're
Just a short while ago, we understand a lawsuit was filed. They are apparently working to find a court date. We will follow the law and wait for the court date. Thank you.
Thank you.